Welcome to AFOMP webinar. I'm not sure this is how much time. I think we every month we have a webinar. We start this webinar stuff from 2022. At that time, due to the COVID-19 pandemic, so we start the online webinars. And thanks for coming. And we lots of speakers and moderators served for our webinar. And this time we are very lucky to have Professor Natalka and Professor Cheryl Lian to serve this webinar. Firstly, I would like to give a brief introduction of our moderator, Professor Cheryl Lian. Professor Lian currently is an associate professor at the Singapore Institute of Technology and the current president of the Society of Medical Physics in Singapore. So she has a academic background and previous work experience in medical radiation physics. So currently, her research topic includes medical radiation dosimetry, imaging AI, and innovations in health technology. As an educator, she is also interested to improve medical radiation science instruction by a way of technology enhance the personalized learning. So, Professor Cheryl, it's all yours. So I will pass the microphone to you.
Thank you so much, Prof. Jin, for introducing me. Now I'll go ahead and introduce Professor Natalka Suchowerska, who will be our distinguished speaker for today. I'd like to start with a brief bio of her background. So Professor Natalka, she's a distinguished physicist with 4 decades of medical physics experience. So Professor Natalka has led many successful research collaborations, secured patents, and was recently recognized as one of the top 100 Women of Influence in Innovation. Her research group has also received the acclaimed Roberts Prize for the best paper in physics, in medicine and biology for their groundbreaking work on identifying 3 types of bystander response after radiotherapy. Professor Natalka, she's an honorary member, of Astro Society, and has in recent years co-founded the Help Ukraine group to support oncology professionals during the war. The title of her talk today is I'm a medical physicist, qualified and experienced. Where to next? Over to you, Prof. Natalka. Prof. Natalka, your mic is currently on mute.
Thank you for the kind introduction and also generous introduction, and also for the invitation to present here. This topic is probably one of the hardest topics I've ever had to prepare for, because it's got no equations and it's got no experimental results. It's simply after 4 decades of working in medical physics, looking at different careers and different paths and identifying where the sorts of journeys people have taken. Also, I felt really uncertain about not having data. And so therefore we're having difficulties here. Sorry, we're having difficulty in advancing the slide here. We'll do it this way. And so I acknowledge that I tapped into some other experts with other experiences to tell me what they thought the journey should be, and this second phase of one's career in medical physics. You'll know many of the names. For example, Professor Paul Keel, the director of ImageX, has been responsible for many of the innovations in the modern technology we see in our clinics. Anna Ralston's a clinical medical physicist. Claire Dempsey is now the acting CEO of ACPSM, but also a clinical medical physicist. Nick Cardcastle, you will know from maybe the textbook he's just written, which is the next edition of the Metcalf medical physics text. But also I've asked Ruslan Zelinsky from Ukraine and Bogdana Bachinska to tell us a little bit about their careers after qualifying and the sorts of things that they're experiencing. So first of all, congratulations. You've got your physics degree, your professional certification or registration, and now and some clinical experience. And now this clear path that was set before you in your training has become a little bit not so clear, because you have to make decisions for yourself as to where you're going to work and what you're going to do. I looked back at my mentors, and Professor Hendy, who you'll know from his textbook, described some of the responsibilities of medical physicists in 2008. And it spread from knowledge to research to translation to development, patients, quality and safety, teaching, accountability. And if I asked you, there'd be at least another 40 more areas. And you can see that the skill set that you need to do this job and to hold these responsibilities is extremely broad. And you can't do everything, so you have to start making choices. One of the first choices is clinical or research. And if you look at the characteristics of people who go into clinical, for example, they're usually motivated by clinical needs. Therefore, there's a patient on the bed and they need to be treated. And this is, you need to be a realist. You can't say, oh, well, we'll do this later. We'll have a think about it for a few weeks. It needs to be done now. They tend to be procedural, as in there is a certain protocol you need to follow and a procedure you need to follow. And you can't go off doing something in a cowboy fashion. Whereas people who do research, we're having difficulty advancing the slides. I apologize. They are hypothesis driven, and they tend to think in the virtual space, which I describe here as a dreamer, and they're creative. And you can see that these two groups do not necessarily speak the same language, and there can be a tension between them. But it needs to be a healthy tension, one where there's a mutual respect to each other, to each group, and what they contribute to the equation. So we've said there are different characteristics, the people that go into clinical or those that go into research. So here, when selecting your path, it's really important to think about, where are my strengths? What am I good at? Frequently, medical physicists are either clinically based and do a little bit of research, or they're research based and do a little bit of clinical. It's very difficult to do both at the same time because there is this very different approach to practice. There's also a third character type in medical physics, and that's the administrator. And they have different characteristics to their personality. So people who are very good clinically then often ascend to being head of department. I've even seen them becoming CEOs of hospitals. And they're not necessarily the best people to be administrators. So different people with different strengths do different jobs really well. Very frequently, we, for example, feel most comfortable in the clinic, but do a bit of research and do a bit of administration. And it's the things that we don't like that we tolerate, but they are not our strengths. So here are the people that I asked to contribute and answer some questions. I have a hypothesis that there is a 5-step process that can support you in that second phase where there isn't a clear path and you need to make decisions for yourself about things that you can do to advance your career. And I asked them, what did you do next after you qualified? What were the things that were important? And so, as I said, I put forward a five key steps, and I looked at whether the interviews that I held, which is the raw data here, whether they supported this model. So first of all,
just being open to opportunities, and if something has come up, then evaluate it. To me, it's a big decision with many factors.
So that was Paul Keel's response. I must apologize, there is difficulty with some of these advancing of slides.
but I knew it wasn't in a university. I wanted to work in society where I could make a difference. I kind of fell into the career as a radiation oncology medical physicist, but then I loved it so much, and I knew I was in the right. I was in the right area. I really just wanted to become qualified initially and to work as a clinical medical physicist. So I needed a new challenge. So I moved to another city, to Sydney, which has got far more opportunities, and I ended up taking on a management role. I really tried to do that. Again, I thought, well, I'll see if I get the job, and then I did. Got a whole new set of skills that I needed to learn, but a whole lot of challenges. Honestly, I didn't have a clue.
Natalka, the speakers are very muted. Could I possibly get you to reshare your Zoom screen, but at the same time, when you reshare it, to click on the checkbox?
I'm sorry. I'm sorry, I can't hear you. Could you repeat that?
Yeah, the speakers' responses, the pre-recordings are very muted. I think it has something to do with the way it's shared, your slides are shared. So if you could click on the share Zoom and make sure to check on the tick boxes that say share audio. That would fix the problem. So if you went on to click on the Zoom
share
screen,
sound and optimize for video clip.
Yeah, that would be great. I think we need to rewatch that because it was very blur at my end, very muted. Thank you.
Hopefully this will work. Let's give it a go.
University. I wanted to work in society where I could make a difference. I kind of fell into the career as a radiation oncology medical physicist, but then I loved it so much. I knew I'd achieved I was in the right area. I really just wanted to become qualified initially and to work as a clinical medical physicist. Felt I needed a new challenge. So I moved to another city, to Sydney, which has got far more opportunity. I ended up taking on a management role. I'd never planned to do that. Again, I thought, well, I'll see it, I'll try it, I'll see if I get the job, and then I did. And that brought a whole new set of skills that I needed to learn, but a whole lot of challenges.
Is that better?
That's much better. Very clear now. Thank you.
Opened a lot of doors and given me a lot of satisfaction in my career.
So I might just fast track a little.
My journey, there hasn't really been that sort of 5-year plan. I want to go from A to B, but I think there really has been just being open to opportunities, and if something has come up, then I've evaluated it. To move is a big decision with many factors.
So you can see from these 3 presenters that they didn't have a clear 5-year plan. I'm going to be head of department by the end of 5 years.
My career as a medical physicist began in 2011. I didn't have any necessary education. I didn't have any experience, but it happened that I had to treat patients. I still remember those emotions when I understood all the responsibility for the patient's life, but at the same time, I understood that due to lack of knowledge, I can do even worse for patient. And the situation is probably typical for countries where there are no education programs for medical physicists. The feelings of responsibility was my first motivation. My first professional goal was knowledge, of course. These were difficult years of self-education for me, with successes and failures, of course. But when I reached some level of knowledge, I asked myself a question: how can I help to next generation of medical physicists in Ukraine to have an easier professional way than me? So my goal has changed from self-development to the development of the medical physics in Ukraine in general. because when you develop yourself, you help maybe 1,000 of patients. But when you develop the whole industry in the country, you help millions, and it was my motivation.
So you can see that having the plans.
Honestly, I didn't have a clear path.
My career is
are very interlocked with other things. So when you're interviewed, you're very often asked, where do you want to be in 5 years from now? And you can see that where these people wanted to be was to work in a particular space, be doing particular things, but not necessarily be in a particular position. It's really important to be strategic and proactive and to seek opportunities. So therefore, look for things that may open up or create those things. It's really important to make this last point, and no one really likes to say it, and that's that loyalty is not enough. Many people stay in the same job with the same employer thinking that loyalty will be rewarded. But in fact, sometimes the place where you're working will not give you those opportunities, and you need to move to a different town or a different country. The second step is how important is increasing your knowledge?
I feel in order to continue contributing within the profession, you need to at least keep up and ideally expand your knowledge. Not necessarily across the board. I think working on training medical physics registrars in Australia and New Zealand, the graduates of that training program, in my opinion, have the highest all-round clinical knowledge of any medical physicist in the profession. They are on top of everything across the board. Obviously, as you progress in your career, the ability to maintain that across the board knowledge is really difficult. But what you find is you become an expert in certain areas. So by no means am I an expert across the board in radiation oncology, medical physics, but I know where my strengths lie, and I guess it's important to me that I play to those strengths.
So therefore, creating a deeper knowledge is important?
For anyone who wants to move up into a management role, obviously there's the standard management philosophy and practice that you need to learn, and you need to understand there are many different management models, and not all of them will fit into your situation.
And there is, I don't know of any medical physics master's course that teaches management, but if you want to manage an installation of new technology, manage staff, upwardly manage the doctors, the environment, the multidisciplinary team, it's really important to have those management skills. So broadening your knowledge.
The manufacturers of all the technological improvements are very keen to tell us about the clinical benefits or the benefits to efficiency, and that's all true. However, as medical physicists, we're the right people to also be aware of the risks. So we have to teach ourselves to stand back, understand the new technology to such depth that we can also foresee where it might do harm instead of good. And we're the ones who should do a risk-benefit analysis and teach the clinicians about this so that we don't adopt new techniques immediately like a new toy, but we think about how to do it safely and effectively.
And I'm sure many of you recognize that situation where you bought new technology and everyone wants to use it, but it's not a plug-in and play system. You do really need to know what the risks are, and knowing how to be assertive and communicate that you need to take a certain amount of time to commission is really a new skill set, a new knowledge. I've summarized what I've understood from those interviews here, but the final point is that bright minds thirst for knowledge. And when I see people coming to me to either study or to apply for a position, I look at what's the additional knowledge is that they have. And I know that they are still on, still alert when they have sought new knowledge and adopted the things that they've learned. The third step is, do you need motivation and momentum? And let's see what they say on this one.
If I look back at what I'm most proud of and what I got the most satisfaction from, it's probably the clinical trials work and work related to changing patient care and practice. You work through all of the trial design and the QA components and all the hard work of recruiting and making sure everything's sort of running smoothly, and technology-wise, it's all sort of keeping up with what's happening in the field and not sort of getting out of date. And you get to the point of it where you get an outcome at the end, and that gets published in a nice journal, and you can see that the practice has changed because of that trial, and those patients benefited from it. That's a really satisfying part of the medical physics work. And so I'm motivated by wanting to take my understanding of physics and technology and work with my clinical colleagues to solve real problems that patients face and get to a point where we've implemented a new technology or a new technique, and that's made a difference for the patients getting treated for the relevant diseases to that technology. And so that's probably my key motivation is actually making changes and pushing the field forward incrementally.
And I think many can identify with that motivation, but there are others.
To, day in, day out, to come to work, to do all the difficult things, the administrative things, in addition to the wonderful things, the experiments, the trials. And really, it has been just being involved with healthcare. I think it just gives a genuine feeling of satisfaction and purpose in life.
So purpose really comes out in all of the interviews, and obviously I've cut many of them just because it's too long. Also note that the difficult thing for Paul as a research and development and entrepreneur type medical physicist is the administration. So that's really interesting. The difficult is not the maths and the physics.
But certainly burnout is a real thing. But what I do brings me a lot of satisfaction. So I don't think I could do it any other way. What I do gives me the energy and the drive to keep doing it because I enjoy it so much and I find it so rewarding.
So one of the secrets in not stagnating is to enjoy what you're doing, or to do what you enjoy. And this gives you that frizzle that keeps you going. So it's really important to recognize what is it that pushes my buttons, and it will be different for different people. So what do you enjoy?
I started to realize that I missed being a clinical physicist. I really enjoy the practical side of medical physics. I enjoy the technology and the dosimetry tools and the satisfaction of working on a plan or a project that is going to directly impact one patient or a small group of patients. There are certainly great benefits of going into a management role, but there are also sacrifices that come with that.
So after working for 10 years as the director, Anna chose to then step back and be a clinical medical physicist again, because this gave her pleasure and this was her new path.
Saying yes to things in different areas has been really important to me. So I'm not just focused on one particular area. I say yes to clinical responsibilities. I say yes to educational responsibilities. I say yes in the global health space. I say yes in the the training space. So the variation of the things that I'm working on help give me that energy to keep going. And the people that I get to work with by saying yes to these opportunities. My sphere in the profession, I feel, is large. And the people that I've met and worked with by saying yes to these opportunities gives me the motivation and the energy to keep going.
So those international colleagues, the collaborations at that big level are things that really stimulate Claire. So momentum is a very personal thing. Qualifying is the start of a new adventure. And I think you need to see it as that. It's a new adventure. Drive and momentum will prevent stagnation because you can just stand there and wait to decide. But by not doing anything, you've made a decision. So it's important to search for opportunities and do what you enjoy, because the things that you enjoy are the things that you'll be successful in. The fourth step is networking important? There are two aspects to this.
So networking is great for the individual, where you can learn from other people. You have the satisfaction of sharing your ideas with other people. Other people learn about you. Then that does improve your job opportunities, but also your opportunities for collaboration. And for example, going to a conference, it's not just about what you learn during the sessions. So much is what happens at the lunch break or at dinner, when you're sitting with a group of people who you might not know very well, and you're talking about what you just learned. And then suddenly, out of the blue, there is some idea of collaboration. You've got an idea that might help someone else, or vice versa. And before you know it, you've suggested that you work together after the conference on a research idea or a way of implementing a better technique in the clinic. And so that's not just for your benefit and to keep you stimulated and to keep your career moving. It can also translate into real improvements in the outcomes for patients. Things that bind us together as a community rely on volunteers, people like you putting up your hand to say, yes, I'll go on that conference organizing committee, or I'll be part of a panel that's writing recommendations on a new technology, or I'll do some teaching. Whatever it might be, the whole profession, the standards get lifted. And it's also a great way, if you're stuck in a job where you don't have the support to explore your ideas or expand your horizons, to join with other like-minded people in a volunteer capacity on a committee.
And many of the task groups, many of these recommending bodies now do meet online. So you can work with people through networking in such a way that you never could before, when people used to actually sit at a table in one location. So networking is really important in a collaboration and in finding new mentors and mentoring other people. There's another aspect to networking that is frequently forgotten, but very important. But very important.
I think I've been lucky in my personal life in that I've had an extremely supportive family, particularly my husband.
And that is your personal network. It's your personal network that keeps you healthy. So expand your professional network and social network, but cultivate a healthy work-life balance. This is really important. Being professionally well connected keeps you professionally healthy as well. You don't go off and become a fanatic on something that maybe will have no solution or no benefit. The final step is, are you critical and self-aware?
with that, not just the confidence to apply, but knowing that it might be a bit vulnerable as well. And certainly I've had some successful jobs, but I've also missed out on cheap jobs at two well-known institutions in the US as well. I've missed out on positions in Australia. I've missed out on lots of grant opportunities. And I think amidst the success, really there has been a lot of failures, which is humbling, but it doesn't that sort of rejection, failure is just part of the job as well. And I certainly don't get everything that I try to achieve or that I apply for. I think just sort of understanding and accepting that is important.
I think that's a very sage message to take on board, especially coming from Paul Keel. I'm sure he won't appreciate me putting failures across his video, but he'll see the funny side. But this is what happens. You keep applying, you keep searching for opportunities. And you have to be in the race to win. And you just accept it and learn from things that don't quite work.
I know where my strengths lie, and I guess it's important to me that I play to those strengths. And you talk about networking. Obviously, if I know where my strengths lie, I also know people that have strengths in other areas that complement what I know. So networking in that way is really important to build, particularly if you're in a training space or if you're helping other clinics. Having a network of people that complement each other is really important. But I do rely on that network of colleagues to provide me support and mentorship, and really a sanity check when I'm going down a path and I'm not quite sure whether what I'm thinking is correct. No single medical physicist will be able to solve all of the problems all of the time. So it is really important that we all work together and also work with other disciplines. So our radiation oncologists, radiation therapists, IT, nurses, always working together and communicating with each other to ensure that the services we're providing is appropriate and giving the greatest benefit to the patients, which should always be the focus of what we're doing.
So you can see, although I'm proposing a 5-step model here, there is an interplay. Networking does help you become critical of yourself and aware of yourself. One of the things that I thought was really interesting with Nick Hardcastle is that, for me, he's a relatively young medical physicist, and he took it on to edit a textbook. And I thought, what was it that pushed you to do this? What was your self-awareness? And this is what he said. Oh, my apologies again. I'm not sure why this is jumping.
Sense. And textbook, I have used the previous editions many times throughout my training and clinical work, and I know my colleagues have. Everyone has a copy on their desk. I've gone to places overseas where people have used it, and what I found that I really enjoyed about this book is it was a quite accessible textbook to break down some pretty complex parts of medical physics. So when I had the opportunity to contribute to it, because I had benefited from it greatly, that was a real strong motivator for me to try and put my own, provide my own input into it to make sure that these new techniques and new technologies that are coming out are also presented in the same really accessible way that a master's student can pick up the book and get the gist of what's going on. And that to me is I think a really big benefit to the community, having that accessible resource, because I do enjoy the teaching side of things and educating, and I find that textbook is a really good pathway to reaching people in a plain language, easy to understand manner.
So you can hear that self-awareness coming out in Nick. So it's really important to be critical, be positively critical. Take time to reflect on where you've been and where you're going and how well you did. Be honest with yourself. Everyone knows if you're faking it value yourself for what you are, and others will see this, that you feel confident in who you are and what your position is. And own your achievements, because this will keep you positive and motivated. You'll feed off this. And own and learn from your failures as well. It's pointless saying, oh, it was someone else's fault and so on and so forth. You did your best, it didn't work out. Why? I think this is really important, self-awareness. And these are the 5 steps that I'm proposing in this model. So something that I asked all of them is, what does success mean to you? And they all said something very similar to this. So I've simply just put one slide here for you to hear.
Yeah, I can't sit still. It's probably just part of who I am. So having the nice view and the big desk is not something that's important to me. I got into this profession because I wanted to help people, and really sitting behind a desk is not where I feel I'm helping people the most.
So it seems that everybody was motivated. The key place they wanted to get to was helping people, but they all approached it slightly differently. And I think this is what the diversity looks like. We're all very different, and we have different skill sets and different moves, shall we say. But if we work together as a team, this is the way that we can advance efficiently and effectively in the area of medical physics. However, in this audience, there will be people who have this year experienced severe floods. Some have experienced earthquakes in the recent years. And there are factors in our lives that will affect our careers, but the cancer patients keep coming. Patients will keep coming. They do need to be treated. And these factors, we need to deal with them. I was reminded of this quite markedly, particularly with the new path that I'm taking with this event. And this is from the New Indian Express of the bomb that hit the Children's Hospital in Kiev just 2 days ago. And the radiation oncology wing was affected. And many people have asked me, how was it affected? What was damaged? But also, what choices do you need to make in a disaster situation? And I guess, given the topic of this talk, does this model still apply? So fortunately, thank you to Dr. Ruslan Zelinsky, whom you heard earlier, I was able to record, he was able to record this short clip from the senior radiation therapist at this hospital and how she experienced it and what motivates her to continue. And I think there's a lot to be learned here.
Мене звати Бачинська Богдана. Я працюю в Національній дитячій лікарні ОХМАДИТ з 2018 року рентген-лаборантом на лінійному прискорювачі. У нас був як звичайний день. Ми починали з пацієнтів. У нас спочатку зранку йдуть пацієнти під седацією, тому що ми їх хочемо швидше відпустити, пролікувати. Пролікували ми десь приблизно 5 пацієнтів встигли. На даний момент у нас в лікуванні 12 пацієнтів. Почалася повітряна тривога, і наші пацієнти зателефонували нам, що вони затримуються, тому що не можуть добратися. І якраз в цей період ми трішки відійшли в коридор ближче до нашого приміщення кухні, але в цей момент пролунав дуже гучний вибух. Ми були поблизу скляних дверей, які розсипались, слава Богу, нікого уламками не заділо. На нас впала стеля. Ми потім швидко перейшли в бункер, вимкнули всю апаратуру, яка була. Слава Богу, що не було ніяких пацієнтів на лікуванні і якби перебоїв таких під час лікування не було. То все швидко вимкнули. У нас пошкоджені наші кабінети фізиків, там станції були для планування, кабінети лікарів, там винесли рами, пошкоджені стіни, Потім їх ще й додатково затопило, тому що там прорвали всі труби, вся техніка знищена повністю, абсолютно. Ну, монітори, вони пошкоджені, тобто вони залиті були повністю водою, і там осколки були, рами повилітали, деякі системи, ну, блоки живлення і УПЦ були взагалі розірвані навпіл на маленькі шматочки. Деякі збереглися, але вони були затоплені, тобто вони вже не будуть працювати, це 100%. Тому так. Ну, ми вчора ще, в принципі, ми відновили хоча б якийсь вигляд наших кабінетів, тому що ми вчора цілий день прибирали осколки, дякуючи волонтерам, взагалі дуже багато людей, які нам допомагали, це просто неймовірно. На кабінет комп'ютерної томографії і бункер лінійного прискорювача не постраждав, на щастя. Тобто апаратура ціла, але, на жаль, було повністю знеструмлене живлення, тому якби зараз ми намагаємося підключитися до підстанцій, які нам привезли, і відновлюємо роботу. Зараз інженери працюють над цим, тому коли вони закінчать, вже є надія на те, що ми можемо працювати, тому на завтра ми вже плануємо викликати пацієнтів. Я думаю, що головна моя мотивація – це рятувати людське життя, поправляти людське здоров'я, надавати шанс на життя, на якісне життя. Тому ми заради цього і працюємо. Заради цього, я думаю, всі медики працюють і стоять на цьому шляху. Але коли з'являються такі новини, коли ти бачиш, що діти гинуть, твої старання і твоя робота множиться просто на нуль. І дійсно іноді буває, ти дивишся на це і дуже сильно засмучуєшся. Але зараз, в першу чергу, потрібно себе мотивувати, дійсно жити далі справлятися з труднощами, далі лікувати пацієнтів, виводити їх з їхнього стану. Тому якби ми заради цього працюємо, заради того, щоб наші пацієнти мали шанс на життя.
So you can see that the motivation is always the patient's life and to give them the best quality of life, irrespective of the environments in which you work. So this is the physics office wing and how it's flooded, and this was just the day before yesterday. The physicists went to work, they're working normally on their planning computer. 15 minutes later, this is what it looks like. So you can imagine how difficult the environment is and the influence of the environment on what they can do. And yet they are planning to start treating patients again tomorrow because they were able to show leadership and motivate the public and others to help clear up in some way so that they can continue treating. So when talking about what path you should take after qualifying, I'm sure no one can imagine that this is something you'll need to face, but all the skills that you have as a medical physicist, you need to apply for situations just like this. There is no protocol, and you need to use all your scientific knowledge in order to work out what do you do next. And in Ukraine, they're staying to treat their patients. I can't. So back to the question, medical physicist, qualified and experienced, where to next? For me, it has been 4 decades and it has been 4 different paths. I worked in the clinic for 10 years. I lectured in the university for 10 years. I went back into the clinic and did research in the clinic. And then for about 10 years, I did research which was more to do with medicine, more blue sky type research, but at the same time, always doing some clinical experimentation. So therefore, your path doesn't have to be a single path. It can change. And in fact, changing keeps it fresh if you have the opportunity. But my final slide, I've intentionally kept it with this poor resolution, because your path to the top of your, to become qualified, which is like climbing a great hill, when you reach the top, as Nelson Mandela put it, one only finds that there are many more hills around you to climb. And you need to decide which one you want to climb. And I think the 5 keys that I've given you will help you, whichever one you wish to choose. And just because you choose that hill to climb doesn't mean you can't come back to another one and go on another journey, which is exactly what I did. Do what you enjoy. I wish you luck. Please consider each of the steps very carefully and reflect towards yourself what you want. This makes a really big difference. Thank you for listening to me, and I'm very happy to take any questions.
Thank you so much, Prof. Natalka, for your amazing talk. Very, very highly impactful with all the 5 key steps to support career development for medical physicists, both in mid-career and even beginning as a physicist. Yeah, especially heart-wrenching, of course, were all the videos shown of lived experiences of the radiation therapy crew at Ukraine, the hospital in Ukraine. I think I brought a tear to many of our audience's eyes when you shared all of that. And particularly, what I particularly loved was all of that videos that you showcased in terms of all the lived experiences of the 5 medical physicists in different aspects of career, of different strands of medical physics careers. Yeah. Excellent. So actually now I'd like to open the floor to all the audience members here. If you have got any questions at all, I would like to invite you to really unmute your microphone. But if for some reason or other your microphone is not working, please feel free to type your questions for Professor Natalka in the chat box below. If there are no questions at the moment, I'll get the ball rolling. Probably I'll ask Professor Natalka a question that I have. It's probably easy for you, and that is, what would you say would be the top character trait? Basically, it's just to summarize the series, the top character traits of a person in medical physics.
A person in medical physics? Well, I think if you have done a degree in physics, there are many other careers that you can pursue where you'll make much more money and maybe even be famous. But I think people who do medical physics have a need, and you heard it many times with all of them. They want to help people, and they want to help the most vulnerable people. And I think that the reason why I included the Ukraine videos is because so many health facilities are being bombed. So the people who are going to hospitals to work as doctors know that they are making themselves targets. And yet they go to serve people, to help the most vulnerable. And I think this dedication that we see, how many times have I watched Anna Ralston, the clinical physicist, work well into the night for one patient, collecting dosimetry data because she wanted the best for that one patient. And so I think the key characteristic of all the people that I interviewed, and the interviews were very long, I can assure you, it took a lot of work to edit it down, although there were a lot there. The key characteristic is that need to care for people and give people the opportunity to have the best possible life.
Thank you, Professor Natalka. That's really well answered. And yeah, that's a unique trait that distinguishes medical physicists, I think, in various junctures of the career. Yeah, we're all led by this mission. It's a character trait. That's great. Thanks so much. Question. I'll just like to now read out from the chat. We have an incoming question. Densible, thanks for your question. And Densible says, hi, I'm an early career medical physicist. Her question is, how can I, as an international student, who has just graduated with a master's in medical physics in University of Sydney. How does she apply for a residency program in Australia?
Well, there are a number of factors associated with this. And I think the best approach is to make contact with ACPSCM, which is our professional body, and look at the criteria related to the program, and it's called a registrar program. I think the best thing is to go to the ACPSCM website and also to contact the office.
Thank you, Professor Natalka. It's a very practical answer to that. Yeah.
It's also, I think, whether you're applying for that program or applying for any program, it's really important to be familiar with the program. So it will be well described in any country what the training program is about, how it works, and so on and so forth, so that you show that you have the knowledge and the interest. It's not that you want to do it but know nothing about it. So do the homework, and I think this is really important.
Okay, that's clear. Thank you. Yeah. Maybe I'd like to invite the audience members for any more questions. Just type in the chat or unmute your microphone if you have any further questions to ask.
I think unlike a scientific presentation where there are concepts to clear, I think this is quite a different sort of presentation.
That's true. Are you going to patent your 5 key steps to support career development? It's a really good framework.
I think that this I think those ideas are very common. It's not like I've invented the wheel or anything. But I think the difference is reflecting on our profession and to take the time to think about how it reflects on me as an individual. I think there isn't one answer for everybody. And so each person needs to do it individually. Another thing which I'd strongly recommend is to do courses like, for example, the foundations of leadership in radiation oncology. And that has been run through ESTRO in recent years. I don't know if the recent ESTRO Meets Asia conference will have it as a pre-conference course. But it's really excellent because it relates those leadership and team building skills to radiation oncology specifically. And I think in radiation oncology, we're very multidisciplinary, where everyone has a very important role to play, and you can't do the job with anyone without any one profession. So it's really, it's an important skill to have.
That's absolutely right. Thanks so much. Probably I just have one more question for Professor Natalka. How do you see the different elements? How do you think the framework could be further refined? How they, for example, in how the way the different elements work together?
There is certainly a great deal of interplay between the elements. And in fact, instead of having them as a list, it's really important to see how they interplay with each other. And they certainly do. So it's almost like a sphere where there's a lot of interplay and mapping across. So you can see knowing yourself can enable you to network better, but by networking, they can feed back to you that how you're performing, and you know very quickly where you need to pick up your socks. And the same thing with momentum. By networking, it feeds into your momentum and into your drive to keep going. So the whole thing is interrelated. But I know physicists like to break things down to the fundamental components. So that's what I tried to do here.
Well, particularly, again, I commend you on all the effort to compile all the videos of lived experiences from physicists from all walks of life. So thank you so much for that. Yeah.
And thank you to all the physicists that were very happy to give their time. Nick Hardcastle, I cornered in Munich. So he just got off the plane and gave the interview. So people were very generous. So thank you to everyone. And particularly, I'd like to thank the people from Ukraine because, you know, it is a stressful situation. It is a tragic situation. And yet they're willing to network and record while they experience terrible things. So thank you to the Ukrainian team as well.
Audience members, I've just put in a chat. Please put your feedback and comments in the feedback form that has been sent to you via the chat. If you click on, it's a Google Docs form requesting for your for you to fill this up. You can give comments about what you would like to see in future, and even comments about this webinar. We have just a couple of minutes left, but if there are no further questions, thank you so much again, Professor Natalka, for your time spent with us today and for sharing so much of your wealth of experience with us. It's hugely appreciated.
Thank you, Professor Cheryl, for hosting the session and helping me with the audio when it didn't come through as well, particularly. Thank you.
We've got time for some more. Audience members, please keep your comments coming in through the chat if you'd like to talk to us, if you'd like to talk to Prof. Natalka in particular. Yeah, that's lots of wisdom from our audience members here. Lots of thanks, Professor Natalka. Lots of wisdom and efforts are so impactful, the talk. It motivates us. Thank you, everybody. Yeah, it's a huge turnout today, 70 audience members at its peak. Very good.
Thank you.
Okay, with no further questions, do remember to fill out this the feedback form. I'm just going to paste it in the chat again for your easy access. And that's it. Thank you, audience members, and have a great day. You can just proceed to leave the webinar.
Thank you.
Thanks so much, Prof. Natalka.
Thank you.
Thanks.